I'm Julie Wilcox, and I'll be sharing a little bit about myself as well as introducing this event and our speakers in just a moment. First, for those who may not know, I'd like to start with JOMA, the Jewish Orthodox Women's Medical Association. While Jewish and Orthodox are in our name, our mission extends to all Jewish women, as well as members of our broader communities who are interested in medicine, health, and wellness. JOMA is dedicated to empowering Jewish women, physicians, and trainees from pre-med through practice by fostering mentorship, leadership, and academic growth. We also mobilize this network to give back, whether by filling critical medical gaps in Israel, providing culturally sensitive health education, co-hosting academic collaborations, or launching initiatives like the Mindset Birthright JOMA Medical Mission. Our mission is not only to support Jewish women in medicine, but also to activate their leadership for the good of the Jewish people and the world. I'm Julie Wilcox, co-director of JOMA Wellness alongside Dr. Jacqueline Segelnick. I'm a nutritionist and wellness consultant with a master's degree in nutrition, as well as the author of The Win-Win Diet, How to Be Plant-Based and Still Eat What You Love. For the past 20 years, I've worked at the intersection of wellness and leadership. Through my program, Leadership and Wellness, which we offer here at JOMA, I guide physicians in using wellness practices to prevent burnout, strengthen leadership skills, and enhance well-being at work and at home. Most importantly, these strategies also help physicians create the best possible environment and protocols for patient care. At our last JOMA Wellness Committee meeting, I suggested this event, having worked with medical institutions including Columbia Irving Medical Center, Mount Sinai, and Albert Einstein Medical School. This subject is close to my heart. While many lives have been saved thanks to Western medicine, I believe, and research affirms, that many more could be if lifestyle medicine were embraced, not simply as an emerging specialty, but as an integral part of mainstream care. Tonight, we'll hear from two incredible speakers who will elaborate on this. First, we'll hear from Dr. Amy Comander, a breast oncologist and director of breast oncology and survivorship at the Massachusetts General Cancer Center in Waltham and at Newton Wellesley Hospital. Dr. Comander also directs the lifestyle medicine program at Mass General Cancer Center, serves as medical director of the Waltham Center, and is an instructor in medicine at Harvard Medical School. She completed her residency and fellowship training at Beth Israel Deaconess Medical Center and Harvard Medical School, and is board certified in internal medicine, hematology, medical oncology, and lifestyle medicine. Then we will turn to Yoav Jacob, a fourth-year medical student at Albert Einstein College of Medicine, who combines his passion for food, health, and education to advance lifestyle medicine in medical training. He developed a lifestyle medicine and motivational interviewing workshop for students entering clerkships and is leading additional initiatives to expand nutrition and lifestyle medicine in medical education. He is deeply committed to improving how future physicians learn to apply lifestyle medicine in patient care. I'm going to turn the table over to Dr. Comander now. Thank you so much for joining us tonight.
Thank you so much, Julie, for that kind introduction. And it's really so wonderful to be here. Thanks to all of you for coming. I know those of you on the East Coast, it is late. So thank you for being here with us. I know we're all so busy, so we would love to fit in these things when we can. And it's also an honor to do this with you, Yoav. Like when I share my little story, I did not know anything about lifestyle medicine in medical school. And I will acknowledge they had nutrition lectures in the evening that were optional. And I did not go to them. So anyway, so you're really paving the way. And I'm so excited to learn from you. So I'm just going to pull up my slides. You can bear with me for a second. And I do have slides, but I also want to acknowledge that, oops, I went too far ahead. If people have questions, certainly I do want to try to make this interactive, but it's a little hard. But are you seeing the proper view of my slides? Julie, can you let me know? Do I need to fix see here? Is that better?
That's good. I think that's better.
Yeah. Whatever's going on. I don't always give talks to this computer. Okay. So what I'm going to talk about, and then in the next 15 minutes or so, is just give it a little bit of an introduction about lifestyle medicine. And then, of course, afterwards, we're going to hear Yoav's perspective too, which is wonderful. So I'll just start. How did I get interested in this field? So again, I was not into this in medical school. I will say I was a runner. I was mostly at that point plant-based and very health conscious. And, certainly I chose to go into internal medicine and then later specialize in oncology. But I wasn't I didn't really study culinary medicine or motivational interviewing, or all the things we're going to talk about later in this presentation, or really know what lifestyle medicine was. And so how did I learn about it? And honestly, when I started at Mass General, I want to say it was in 2012, something like that. I remember seeing a flyer that the Institute of Lifestyle Medicine here in Boston and Harvard Medical School were hosting this conference called Lifestyle Medicine. And I was like, wow, that looks really interesting. A lot of the talks were like how to talk to your patients about exercise. Why is sleep important? What are the benefits of a plant-based diet? Just those types of topics. And I was like, oh, I'm personally very interested in this. So I'm going to go. So I went to the conference and honestly, I loved it. I loved the people I met. Everyone was just so passionate about learning about how to help these patients with these tools. And as a breast oncologist, I was like, these are the kinds of questions my patients in clinic are asking me all day long. How do I start to exercise after finishing chemo? How do I lose weight that I gained during my treatment? What type of diet is the best diet to follow after a cancer diagnosis? Those are the kinds of questions our patients want answers to. And I felt, wow, I need to learn more about this field of lifestyle medicine to really educate my patients with evidence-based information. So that's how I got really involved. And I have this silly picture of me at one of the conferences. Yay, champion. Anyway, because I'm really into it. Okay, so actually here's a flyer from that conference. And this is the one that's being held next June. So I actually do highly recommend this conference if you want to get sort of an introduction. This is exactly the conference I attended. I will say that I believe it is now a virtual conference. It's still great. But, I love that my conference was in person because I got to meet all these great people and it's a great positive vibe and energy. But I still highly recommend this conference if you just want to get an overview and it's hard to travel, which I get it, so check it out next June. That's when it'll be held. So again, I alluded to the fact that my patients, again, ask so many questions in their clinic visit. And again, I'm an oncologist. I know people are here from all different types of specialties, general medicine, women's health, OBGYN. I'm just sharing my perspective, but I do think that these types of questions that our patients want answers to is true no matter what type of medicine you practice. And so again, patients want to know, what type of diet should I follow? What type of exercise may be safe given their diagnosis, if they have some type of chronic illness, if they have a history of cancer, et cetera. What about supplements? I mean, we get these questions all day long. Weight management. And then my patient population, of course, has many questions about navigating anxiety, fear of cancer recurrence. So these are the kinds of things that come up all day long in my clinic. So I was really interested in taking a deep dive into this area to learn about how I can help my patients improve their health and well-being, and ultimately their outcome from their cancer. And we do have increasing data demonstrating the importance of these tools, certainly for breast cancer and other diagnoses. So here's a general overview of what is lifestyle medicine. And this figure is taken from the Lifestyle Medicine website. There's the American College of Lifestyle Medicine, which we'll both share a little bit more about that. But here's a definition. Again, we're thinking about using evidence-based lifestyle interventions to treat and prevent lifestyle-related diseases in a clinical setting. And certainly as an oncologist, when I think about this for my patients, I'm trying to help certainly reduce the risk of other chronic diseases that they are at risk for, heart disease, type 2 diabetes, et cetera. But also, again, help them optimize their outcome from their cancer diagnosis. A part of the lifestyle medicine field that I really enjoy is the fact that we really help our patients feel empowered with knowledge and the skills to make these behavior changes. And so we think of these 6 pillars of lifestyle medicine, which are outlined here, which to all of you probably are like, well, that's obvious. Yes, we need to get enough sleep. Yes, we need to think about nutrition and a healthy, I like to use the term plant predominant diet. Exercise is important, avoiding use of alcohol and other risky substances, stress management, healthy relationships. So these are all important, but really to focus on all of these and think about why they're important and do our best to be, actually implementing all of them in our own lives. It is a challenge. So the challenge for us, it's a challenge for our patients, but that's really what we strive to do in this field. And certainly as an oncologist, I try to really understand how I can help each of my patients, certainly adopt these behaviors in the best possible way. So again, thinking about oncology, which is my field, why is this important for me? Again, I'm a breast oncologist. It's predicted by 2030, there'll be close to 5 million breast cancer survivors. And you can see the breakdown of other cancer diagnoses, certainly in the United States, predicted for the next 5 years in terms of cancer survivorship. And this is obviously good news. We're seeing a rise in the cancer survivor population due to advances in cancer treatment, better screening, also aging of the population. But there's really a need to provide comprehensive care to this population. And this is a study from my field, but you can probably do the exact same study in cardiology, in gastroenterology, you name it, you can probably do this. So basically, this study, which is actually done now, this was published in 2019, but it was a study for members of ASCO. I know Dr. Knoll's very involved as well. What are oncologists and radiation oncologists' attitudes and practices about addressing health behaviors? So again, back in 2014, ASCO, the American Society of Clinical Oncology, my organization, was like, wow, obesity and cancer, this is an important thing we need to tackle. As an aside, obesity is a risk factor for at least 13 different types of cancer. So that was appropriate that they acknowledged that. Really, the effort was to increase oncologists' knowledge about nutrition, weight management, physical activity, et cetera. So they did this survey of their members, and you can kind of expect what they found. So the majority of respondents agree that, yes, we need to address weight management. We need to talk about exercise. We need to talk about nutrition. But really only, it says 33% agree that they had adequate training to do so. And basically 49% said that they really did not have training to discuss weight management, behavior change with patients. And like 2/3 of those surveyed said, we don't even have any resources to refer our patients to. So bottom line, this was published again in 2019. And I hate to say it, despite all the work I'm doing in this area, I don't think we've made major progress. So this is an area of improvement, certainly in oncology and of course in other fields as well. And this is really important. Again, I keep emphasizing, no matter what specialty you are in, or again, focusing on primary care, family medicine, women's health, we know that in the United States, unfortunately, and this is a figure from the CDC, 6 in 10 adults in the United States have some type of chronic disease. 4 in 10 adults have 2 or more. And what do I mean by chronic disease? Again, they're all outlined here on this slide, whether it's a cancer diagnosis or heart disease, lung disease, diabetes, Alzheimer's disease. So, these are the major illnesses that, affect us here in the United States and the major driver of healthcare costs. And, what are we going to do to help combat this and address this? And just also thinking about what are the leading causes of death in the United States. And so, heart disease, as we all know, is unfortunately the leading cause of death for both men and women, followed by cancer. And then you can see the other causes outlined here. Again, chronic diseases that, perhaps if we had more tools in our toolkit to help prevent these, we'd all be in a much better place. So again, I don't need to highlight this. I think we're all aware of this too, about the epidemic of obesity in the United States, which is outlined here. It's obviously, and these slides go just up to like 2022, but basically 1 in 3 adults in the United States are overweight, and in terms of obesity, 2 in 5. So basically, again, just a call to action that we really need to think about how we can help our patients and ourselves be healthier. So again, what are these causes of these chronic diseases that I'm highlighting here on these past few slides? Again, a lot of it is due to lifestyles, things that we talked about earlier when I showed you those 6 pillars of lifestyle medicines. Again, tobacco use, exposure to secondhand smoke, poor nutrition. I talked about the importance of a plant-forward or plant-predominant diet, but we know the majority of Americans honestly do not get the appropriate amounts of fruits and vegetables in their diet. And there's, of course, this rise in consumption of what we call ultra-processed foods, which is not good for any of us. And so that's a major factor. Physical inactivity, increasing sedentary behavior, excessive alcohol use. Again, this is all stuff from the CDC, which is the major risk factors for chronic disease. As an oncologist, of course, I'm really interested in like, well, what are the causes for cancer? What are the modifiable risk factors? What can we change? And again, this is taken from the AACR, American Association of Cancer Research's recent cancer progress report from last year, which has all these great figures, but you kind of see the same risk factors, unfortunately, can potentially cause cancers as well. So tobacco's way up there, as you can see, which accounts for about 20% attributable risk of cancer in the United States, followed by excess body weight, alcohol consumption. I'm so sorry, something just happened to my computer. Here we go. Okay. Or diet, physical activity. So again, all of these factors, unfortunately, increase risk of chronic diseases and cancers. Again, I think we all kind of know, but like going into these studies that in general, very small percentage of Americans lead a healthy lifestyle. And how do we define a healthy lifestyle? Again, really the basic recommendation in terms of exercise is 150 minutes of some type of moderate activity each week. Moderate means you could like go for a brisk walk with your friend, talk the whole time that you're getting in some exercise, your heart rate's getting up. Vigorous exercise would mean maybe you can't really talk, but like, you're getting your heart rate up a little bit more. And so we're not really getting that. Diet score, not so good. And we know, unfortunately, body fat is up in general. And again, we still have a high prevalence of cigarette smoking. So again, this is sort of a wake up. And again, this is data from a number of years ago. And I hate to say it's probably not much better now. So again, what about my population? If I think about cancer survivors, again, this was a paper that was published last year based on a telephone survey done by the American Cancer Society, and really looking at over 10,000 cancer survivors and how many of them were meeting these basic guidelines too, in terms of like physical activity, weight management, fruit and vegetable consumption, not drinking alcohol. And honestly, and they were like asking them kind of things in the past 30 days, have you done any form of physical activity? Have you had, 3 servings of fruits and vegetables? So they are kind of like very basic questions. And unfortunately, a very small percentage of cancer survivors were adhering to these as well. So again, one of my colleagues, Dr. Amber Orman, shares this cartoon, and I borrowed it from her, but it's really showing this is kind of like what it's like in healthcare. We're always trying to mop up this mess that, that sink continues to overflow. Okay, we continue to have all this chronic disease due to all these lifestyle factors that unfortunately we're not addressing. And so what can we do to address this? And so we know that if we could, data from organizations such as the World Health Organization show that, again, 80% of heart disease, stroke, type 2 diabetes, 40% of cancers could potentially be prevented with attention to improvement and diet and lifestyle. But is this kind of a wake up? So that's where, again, thinking about lifestyle medicine comes in. And we do have an organization, American College of Lifestyle Medicine, where, again, the mission is really to advance evidence-based lifestyle medicine, again, to treat, reverse, and prevent chronic diseases, and really make this a foundation of health and healthcare. And I think this slide is really important, just demonstrating the benefits and attention to lifestyle factors for so many chronic diseases. We know that with adherence to the lifestyle factors I shared earlier, we can see improvement in blood pressure and lipid profile, certainly weight management, disease, mental health. And again, there's recent data demonstrating intensive lifestyle interventions potentially can lower risk for Alzheimer's disease. Ornish recently published a study on this, thinking about musculoskeletal conditions, cancer, and then, of course, improvement in health for people with type 2 diabetes or other types of metabolic health disorders, such as, I guess it's called MASLD. The name of fatty liver disease keeps changing. But basically, again, this is something that can significantly improve in attention to lifestyle factors. So I like this slide. I just saw this recently, and I wanted to share this just because it highlights the importance of a multidisciplinary team. So, of course, obviously, not one person can help patients make these behavior changes. It really takes a team. It takes doctors, it takes nutritionists, it takes psychologists, physical therapists, as you can see, all the different members of the team, the patient's family, the patient's environment. So I do really like the fact that, in the lifestyle medicine organization, by the way, it's not just doctors who can join. It's colleagues from all different types of specialties in healthcare are part of this organization because we all have this shared mission to help improve the health of our patients and obviously society in general. So again, we know, as we've talked about, lifestyle medicine really focuses on, again, addressing the underlying causes of these conditions that account for the majority of healthcare visits, hospitalizations and costs in this country, really by, again, focusing on, you know, the factors noted on the slide: poor diet, physical inactivity, insufficient sleep, poor stress management, etc. And so, again, when we think about the overall arching goals of healthcare in the first place, often referred to as this quintuple aim of healthcare, lifestyle medicine also really is great for addressing these issues. Certainly at the conference that's in November, we do a lot of focus on, of course, improving health of populations, but thinking about reducing costs, thinking about health equity, thinking about enhancing care for patients, and of course, well being. I know Julie mentioned that at the beginning. And I will say, from my own personal experience, getting involved in this organization, really focused on these issues with my own patients, really has improved my well being. And I do think many of my colleagues would say too, they feel less burned out by really focusing on these like this education for our patients, since it's so rewarding. I want to share a few things, and I'm sure Yoav is going to share so many great resources too. But and if you do check out the American College of Lifestyle Medicine, there's so many ways to get involved. Interest groups for like all kinds of specialties, including, lifestyle medicine and cancer, women's health, primary care, coaching, exercise, you name it. There's all kinds of really interesting member interest groups. There's all kinds of curricula you could take advantage of, just a little more about lifestyle medicine in general, culinary medicine, which I know Yoav is going to talk about. Again, there's just so many great resources and CME courses. In fact, about 2 years ago, they launched this Food as Medicine initiative, which really focuses on disease prevention. And there's many modules now that you can do, which are really well done. So there's lots of ways to get involved and certainly learn more. And, certainly now they're encouraging folks to get involved at every different step of the way in terms of education, which we'll hear about in a few minutes. So again, these are just some examples. You can check out the website yourself to see some of the offerings, to see if some of these things are of interest to you. But no matter, again, what role you have in medicine or what your specialty is, there's lots of ways to get involved and learn more. So on that note, I do want to stop talking so we give you all the chance to speak as well. And feel free to reach out if you have questions for me, and happy to answer questions at the end. Thank you so much.
Thanks, Dr. Comander. That was really wonderful, totally rich with a lot of information we can all use. And now we'll turn to Yoav.
Great. Okay, great. Let me just share my screen. Give me 1 second. Try this. All right. Sounds good. Thank you for having me. My name is Yoav Jacob. As mentioned, I am a fourth-year medical student at the Albert Einstein College of Medicine, the Bronx, New York City. So I feel you on the Eastern time zone, folks. It is late. I'm also the current co-president of the American College of Lifestyle Medicine Trainee Executive Board. So that is a group of about 10, 15 students, medical students, healthcare professional students, residents, so trainees, early career folks. We are this national kind of small group of students, and we do various projects to kind of push forward lifestyle medicine education opportunities, research opportunities for the trainees kind of at our level. And I'm also a graduate of the Institute of Culinary Education, the Health Supportive Culinary Arts program of Los Angeles. So before I earned, or as I'm earning my white coat right now, I had a different white coat that I came into medical school with a different perspective. So just, although I am a medical student, I work with ACLM. What I'm sharing today are like my perspectives. So don't say that I am speaking for them on their behalf. So Dr. Comander spoke a little bit about what lifestyle medicine is and kind of the foundation, which is great to kind of give everyone a refresher. But like, how did I get here? How did I get to talking about lifestyle medicine in my life? So my undergraduate background, I went to the University of Michigan, so go blue to those on the call. I had a background in ecology and biology, really thinking about the system, the world, the environment that people live in. I did initiatives like working on the student campus farm. So we grew produce, we sold the produce to the campus dining halls that would be prepared by students and fed to students. It was this whole circular network. I was working with sustainability efforts. Later on in my time at Michigan, I also worked as an EMT. So I saw patients in the 911 typical emergent cases, but also did a lot of hospital transports and home to dialysis center, are really seeing the impact and burden of some chronic diseases in America on patients in the community. And this is me at the big house. And I am a graduate of University of Michigan, but I graduated in May of 2020, which some of you may remember was a different time in the world. So I did my graduation ceremony over Zoom, and I kind of moved my icon across the screen. And so naturally, I had this sort of healthcare-ish background. My parents are physicians who were trained in Israel. but they didn't really understand the training system here. I wasn't really ready for medical school, like right out of college. Hadn't taken the MCAT. I had some of the prereqs and all the prereqs. And then there was this COVID situation going on. So naturally, what I did, was I went to culinary school because that's what everyone does. And so I left Michigan and I moved to Los Angeles, and I ended up joining this culinary program, which I kind of accidentally found. I had met one person from my Michigan, alumni network who had actually taken a gap year to do culinary school in the middle of medical school. And he had initially kind of planted the seed. And so when the world shuts down and you can go to culinary school, that's what you do. So my program was a mixture of students from like high school graduates, the 16, 17, 18-year-olds, to 60 plus or bored retirees who didn't know what they were doing and just wanted something else in their life. One of my peers in my program was actually a nurse practitioner who I later figured out was an ACLM diplomat. Didn't really know what ACLM was at this point in my time, but she was there taking her career in a new direction. And after my training, that's her picture. That's me in my uniform, my previous white coat. I worked in the food industry for about a year and a half, doing a lot of food access work. So, food pantries and teaching people how to use the food pantry items, because you can give someone a shishito pepper, but if they don't know what to do with it, it doesn't really help. And as I kind of worked through that, having this background as the EMT, healthcare a little bit, I was kind of figuring out, okay, people have this food system question, they have this medicine question. These are really related problems. And having had a little bit of exposure to both, I realized I wanted to kind of answer more of the medicine side of things. So I did the things I needed to do to get into medical school, MCAT, all those things. I ended up attending Albert Einstein. This is my picture from my class because I wanted to include them. I'm in the back there. So I got to medical school, and believe it or not, as Comander already mentioned, nutrition is not the base content of what you'll find in healthcare education. So medical schools, they do still have some, I guess, limited training, I would say. But as already been explained, physicians are graduating today not really competent in these like basic lifestyle counseling skills. The existing content may be pretty fragmented. Maybe it's just in the preclinical. So for those who aren't completely sure, most medical training, it's like you have a preclinical time and a clinical time. So if you're just kind of learning this content in the clinical time, not applying it in your clinicals, how are you to graduate as a clinician and actually implement it in your practice? You're not going to. And so medical education is uniquely positioned to really approach this process and start building trainees and graduating trainees who are more competent in this topic. So I started in the kitchen, then I moved to the classroom. Now I'm in the clinic every day. So like I'm saying, lifestyle medicine is not the current norm. But that said, probably in the last 5 to 7 years, I would say that nutrition and lifestyle aren't unheard of concepts. The average physician probably says, oh yeah, that's important, but doesn't really have the concept of going further than that. And there are definitely a few examples I can discuss at a later point, where culinary medicine is really important in their curricular training, or there's a whole person lifestyle focus in the program. But overall, that isn't what you'll see at every medical school. You kind of do a survey of them. However, as was already mentioned a little bit, there is a lot of work that's going on medical schools and other places that I wanted to highlight. So lifestyle medicine interest groups, these are groups kind of like clubs, I should say. There's about 200 active ones in different medical schools, and there's also ones that are through ACLM directly. And they've been growing in number since they started in 2009. We had a couple, and there's this huge exponential growth in the last couple years. So they run events for their communities, whether they are a medical school, undergraduate program, other health professional program, to provide opportunities to learn about lifestyle medicine. In the same vein, there's now a resident level lifestyle medicine curriculum that several programs, over 300 now actually, have a resident curriculum the next step after medical school is resident training. And so residency programs are also teaching their trainees about lifestyle medicine, which is great to see. Health systems are also starting to notice, even at my own health system here in the Bronx, we have the student interest group that the medical school has, but our faculty in the health system also have a similar kind of parallel group that do opportunities for house staff and faculty to explore lifestyle medicine and how it might apply to their practice. And then across New York City, where I am, all the New York City Health and Hospitals now have lifestyle medicine clinics as well. So there's definitely out there, but what else is there? And as was already mentioned, a big part of this change is working on the reimbursement model, because unfortunately in our system, my perspective is a lot of our healthcare system is based on the symptoms and less on the prevention. And so the money right now is focused on the symptoms. But if we reframe things on how to do lifestyle medicine in a profitable way, that could be one way to encourage expanding this in general practice. Okay, so at my own medical school, as was mentioned, I implemented my own, or I advocated and designed and implemented a 3-hour motivational interviewing and nutrition workshop for students who are entering their clinical times to give them a good basic, these are the skills you should be practicing on clinicals. And hopefully one day when they're clinicians, they implement them as well. And so fixing this problem has kind of been a three-pronged approach. One being general engagement with these LMIGs, these lifestyle medicine interest groups at the different levels and different systems. Second has been creating these resources, so developing trainee advocacy resources to communicate and give them, the little more oomph in speaking with their administrators about why this content is important to them, why they should incorporate it into curriculum, those sorts of things. And then again, really pushing for medical education change using engagement and resources kind of to put forward changes in curricula. So kind of the biggest ways I've found this to be done productively is leaning into student wellness. As is already mentioned, a lot of providers who started engaging with lifestyle medicine, they themselves figure out the benefits. And we're telling patients to eat right and exercise and sleep, all these things. And I can promise you, I hope that no one argues with me that if a provider is sleeping better and eating better and exercising, they will be a better provider too. Because before you're a provider, you yourself are a person. And so one way I've kind of framed increasing this content in curriculum is like, you should be training people to be good people and like happy and healthy providers before you even figure out like the providing element of that. And so doing workshops on stress management, healthy habits, and the high stress training that they're going through has been one way that they've actually gotten this content to be recognized in a lot of curricular conversations. The second, probably more important for a lot of people is this is creating providers who can understand and connect with their patients at a deeper level. You're seeing the patient as a person in their whole perspective. It's not just their diagnosis. You're understanding them as as the 6 pillars kind of put together. When you ask someone these other questions about their lifestyle, they actually understand that you want to get the whole picture of what's going on. And then again, this is really just about advocating for whole person care at like a base level at the provider production level, the medical education piece of it. But where is medical education going? Wish I knew, but I can tell you what I hope for. So one day I'm hoping that lifestyle medicine competencies are required of all healthcare trainees. So right now, people graduate, they have a cardiology core class, they have a gastroenterology class. They have some baseline. Everyone who graduates from medical school must know these things. And I hope one day that, lifestyle medicine is one of those base knowledge things. That's going to mean everyone at a base level has some training here. So that's maybe it's integration into the core curricula, into the clerkships, into residencies, that sort of thing. Medical school students are already pretty embedded in different community health initiatives. Most medical schools have some sort of free clinic that they do, but incorporating lifestyle medicine into those already growing activities could be a great way to start to move the needle forward. It was already mentioned a little bit about interdisciplinary prevention teams. So a patient who comes in with heart failure, when they leave the hospital, they're not just leaving the hospital with their medications. They have appointments. They have a cardiology appointment. They have their primary care doctor appointment. Maybe they might have a nutritionist, a physical therapist who they've been referred out to. So connecting those teams, because medicine is a team effort. It's not just the one provider you ever see. When you go to your primary, you get checked in by the secretary, and then there's maybe a nurse or nurse practitioner, as if it's just an assistant. There's a bunch of people here that can all be part of the conversation. And really, hopefully more and more people realize the impact of lifestyle medicine on student wellness, because medical training is very hard on the students. Providers know this as well. They are working every day and, they feel the burnout, and helping give students the tools to be better adaptable when they enter the clinical sphere full time could be a great way that I hope to see one day. And so I can't talk about all of these things and not kind of mention some more recent developments. So one great thing that I know some of you probably know about is ACLM's, the American College of Lifestyle Medicine, was recently inducted to the AMA, the American Medical Association House of Delegates. So they're the people who are deciding what medical schools should be teaching and learning. And so it's great to see that ASLM now is not only like in the room, like they are at the table. They were recognized, they were accepted, and they are loud. They're having conversations right now to push the needle forward. And then more recently, RFK Jr. had this kind of statement about saying medical schools must teach nutrition or lose funding. To be honest, I don't know exactly what that means and what that's going to lead next to. But I'm hopeful that all change is good. And we'll see what happens with that conversation. But I wanted to kind of recognize those two bigger developments more recently. And I just kind of want to say thank you. Whether you are, a trainee, you're a working professional, there is a way for you to bring lifestyle medicine into your corner to benefit yourself and your community that you're treating. Some references here. And I will turn it back.
Thank you so much, Yoav. Thanks to both of you. That was a wonderful job. Well done. We're going to turn to Q&A. And while those who are participating in the webinar are welcome to send questions into the chat, and I'll pick from there. I'm going to just, as you do that and write your questions down, I'm going to start the conversation off with a couple of my own. So there's a ton of misinformation online about wellness or lifestyle factors, as we all know. Just recently, for example, in the New York Times, there was a story about people who turned away from proven medical treatments due to fear-mongering and conspiracy theories. One woman, for example, chose alternative nutrition and wellness therapies over chemotherapy for her cancer, and she denied the chemotherapy and the radiation possibilities. She passed away very quickly at just 33 years old, leaving behind a young son. This is all according to her sister, who was telling the story. So my question is, how do we help people understand and the public specifically, understand the proper role of lifestyle medicine, using it to complement, not replace, evidence-based medical care? Amy, why don't you start?
I could go first because unfortunately, this is the type of situation that I encounter all the time in my own clinic. Not that someone's, by the way, there always has been misinformation that is out there regarding healthcare, but I think in this era of social media, Instagram and TikTok and ChatGPT, as your doctor, like it's just, even more prominent. And I do see this, and I know others I'm sure can share their experiences as well, particularly obviously in oncology, where, just the other day, a patient of mine, highly intelligent woman, was seeing me for her breast cancer, and I was recommending strongly that she proceed with chemotherapy, certainly kind of like the case you're sharing. And at the same time, she was seeing a naturopath who was recommending a totally different approach. And this patient, highly intelligent, was like, who do I believe? So there is a lot of distrust. And that's actually, fortunately, very a pressing problem that we need to address. And certainly with my patient, I listened. We always listen to our patients and show empathy and try to understand where they're coming from. And of course, I was telling her it's okay to see this other person, this naturopath, but you really do need to be, I showed her all the data, I sent her all the studies. In the end, she is doing my recommended treatment, but I know with a lot of reservation. And, it was a lot of difficult conversations that took a lot of time. Her treatment actually was quite delayed because of it. So it is a problem that we do need to address. But I often state, we're talking all about lifestyle medicine. This is like in addition to the standard therapy. So in the oncology field, all this data regarding the benefits of exercise, for following the plant-based diet, et cetera. These are in addition to standard treatment. This is not a replacement for that. So I always make sure that people understand that fully when I talk about this, but it is a great question that you raise. And Yoav, I'm curious if you've seen some of this, as a student, like seeing some of these examples. You probably have on various rotations, and it's really unfortunate.
Yeah, I definitely think the concept of like healthcare media, the impact in media on healthcare is enormous. Doesn't just apply to one specialty. There's a distrust with media, unfortunately, because they put the byline for whatever is going to be catchy for people to get the read article. But often people don't read the article; they just read the byline and they take that as like what it is. And we talk a little about that in medical education, at least from my experience. We kind of work on how do we engage a patient who doesn't seem like they even want care, but yet they're in the clinic, so you don't really understand what's going on. And it really is figuring out like what their concerns are and addressing them and acknowledging their concerns. And sometimes you don't have the right answer in the first clinic visit because the patient needs to read whatever you're going to give them. If they will, maybe they won't. And you can't necessarily say this is what's right. You can say, I think, from what I've learned, here's the data I have, really what what was already said. But yeah, I think it's a big problem that isn't going away because people rely on the TikTok healthcare and all those things. That's a whole other webinar we could discuss. But I do think it is of concern, and it's something that I think people are thinking about how to talk about, but also like AI in medicine is a growing other topic, and what that will do, I don't know. I'm a little scared of it too, but I try to approach my patients with very like empathy and say, here's the information I have. We can discuss back and forth to kind of figure out the next steps.
Thanks, guys. That was very helpful. Okay, so moving on to the next question. Yoav, you did mention the latest announcement by RFK Jr. So just to repeat that he announced that all medical schools will be required to include nutrition education in their curricula, as most of us, I think by now know, or I've heard that. From your perspective, what is actually realistic to incorporate into medical school programs? How many hours should schools dedicate to lifestyle medicine? How much time should physicians devote to it during their patient visits, in fact? Should lifestyle medicine be a core part of primary and pediatric care, for instance, perhaps, while serving as a referral based component in specialties where it's less central, for example, orthopedics? So, how can we actually see this manifesting and playing out in real time in a way that could work within the system? Because we do have to work within the system.
Absolutely. I mean, the system, like I said, is often symptom based. And the whole prevention question, it's gaining more traction, but it has a lot of work to do. Regarding, what is the right number? I don't think there is necessarily a right number. I think the question is, what do we need to do at a minimum to give providers the confidence to bring up these conversations with their patients? Prevention is not something that can happen in one visit. You can give a vaccine or you can do something like that, but developing a lifestyle is something that patients will do over their entire life. And so addressing those points, it's a continued conversation. I think there's definitely a lot of importance to like the primary care providers, the people that patients will see more frequently. I like to say that if ACLM had its mission complete, they would kind of like, put them out of business, put themselves out of business, right? Because if all of healthcare was preventive focused, there wouldn't really be a need for a special department or a subspecialty or a focus about implementing and encouraging prevention. It would already be integrated. I think there's at a base level, introducing students to motivational interviewing, giving them the concept of like, how do I screen for these bigger problems, especially in this country where more than half the patients and more than half the average patients have a chronic disease that is more from that list. It's like 95% of them are preventable. And so I think giving the students the tools to at least be catching these instances. I don't expect every provider who graduates to, be a registered dietitian. Like that's not what I'm saying. I don't think a doctor needs to be an RD. I think they need to be aware of these things and be well plugged into the resources that exist. And then if they don't have those resources, advocating for those resources, they get a social worker who can help someone find, food access issues or whatever it might be, or a physical therapist or whoever, part of the conversation. I don't have a perfect answer, but I think that's kind of the start to my answer.
That's a great answer. Thank you. Amy, do you want to add anything? I'm going to turn to questions that are coming in from the audience, but please share your thoughts.
It's a great answer. And I just think like just sharing like, one quick study from my field of oncology. I mentioned that survey of oncologists, how, yeah, we're all aware, but we do a really bad job counseling about it. They also did a survey of patients, of cancer patients, like how often did your doctor ask you about your nutrition or ask you about your exercise habits? Just basic asking. And as you can imagine, we didn't do so great, but the patients who were asked, do you exercise? Do you try to exercise each week? Actually, the paper showed that those who were asked about it, if their doctor even mentioned it for like 2 minutes, it did help motivate the patient to like think about that and actually to think about exercise and maybe to do it. So just even like, I know we're also busy, whatever field you're in and whatever we do, but like, even a few minutes just asking a question can make a big impact on a patient and maybe result in them wanting to change those behaviors.
Yeah, I completely agree. I just myself so appreciate the fact that you guys are such champions of this. In fact, I got to experience working with Yoav at Albert Einstein Medical School, where we did exactly just this exercise, whereby we walked the students through the types of questions they could ask in their initial sessions, and also how they could very simply and easily, in very little time, enter the information into the EHRs. And just those basic skills, I think, go a very long way. So we need more people like you guys. Okay, so taking the first question from the audience, thank you for this excellent and timely panel. I'm a clinician working in both urban San Francisco area and rural emergency departments. And it can be difficult to incorporate nutrition and health lifestyle education when we are short-staffed and do not have sufficient time and resources. What are practical ways for primary care providers to incorporate this type of patient care into our practice? Thank you.
That's such a great question. And certainly, I'm happy to start with this one. But certainly, this is something that comes up all the time. And certainly, we learn tips and strategies from each other, through the American College of Lifestyle Medicine, these member interest groups, et cetera. But it's true, we all have work in the emergency department, work in primary care, work in oncology, we all have like limited time and there's so many things to cover in a visit. So it is really hard. And sometimes I definitely make an effort in my visits to ask patients if they're exercising, what type of diet they're following, ask about alcohol, tobacco use, like at least to ask about it and briefly comment on it. But it's true that we don't usually have a lot of time to counsel patients in depth on these issues when there's like a million other things we have to address. So one strategy that, I've certainly learned a lot about through the American College of Lifestyle Medicine is the role of things like shared medical visits, group medical visits. And again, I've seen these more and more, certainly in the primary care realm, but certainly in specialty care as well. And what does that really mean? And I'm sure some of you are very familiar, but it's really like a group medical visit and having a number of patients either in person or actually through a telemedicine visit and providing education and counseling about, I'm just going to take one example, hypertension, lifestyle strategies to address hypertension. And so there's great examples and a published literature demonstrating the benefit, the power of these group visits. You can bill for them. And through ACLM, there is a toolkit that really provides you the information to how to bill insurance for group medical visits, how to document. So we have a member interest group focused on that. So that's one tip, thinking about looking to shared medical visits. But
I just want to interject for 1 second, Dr. Comander, because I want to specify that the question also really addressed for the providers themselves.
how for the providers learn about it? What you're saying?
How can they actually practice the lifestyle elements themselves?
Well, that's a great question. And so learning from you, Julie. So you're right. I mean, yes, like being able to actually
Find the time and yeah.
right? So, and certainly, I look at you up as a medical student, like, gosh, when I think about myself in those days, I think I did run because I needed to for my sanity, but that was probably, I'm sure it wasn't eating healthy. And yes, there was some partying in medical school, but anyway, but I wasn't like prioritizing my sleep and stress management and all that stuff back then. But I do think it's a great question. Thank you, Julie, for highlighting that. And just thinking about those basic 6 pillars. Again, they seem so basic, but like, how are you doing with your sleep? How are you doing managing stress? How is your diet? Think about, are you getting in fruits and vegetables, at least on as half of your plate, fruits and vegetables, at your meals? Like some of those basic things, maybe picking one pillar to focus on at a time to get started would be something I would suggest thinking about. That's a great question.
Yeah, and I'll chime in just to say from my perspective, I always educate and encourage my clients to take as many what I call exercise snacks as they possibly can. So, if you can just in a break room in between patients, whatever it may be, take a minute, do 15 squats, do some wall push-ups. Like if you can do that 5 times a day, you're already ahead of where you were if you hadn't done that. Also maximizing your time off. I know there's not a lot of it, but there is time off. And so then you have to have a priority list of how you want to be spending that time and, might want to put your health and wellness practices at the top there. Even when you're in transit, if you're not driving, for instance, or even if you are driving, frankly, you can do some breathing exercises to try to decrease your stress and anxiety levels. Just keep your eyes open when you're doing them if you're behind the wheel. Or in between patients, take a moment, do some deep breathing. You can do the simplest methodology of box breathing, which is inhaling for 4, pausing for 4, and exhaling for 4. In our leadership and wellness program and through other JOMO wellness events, we do a lot on breathing and meditation, more on exercise and nutrition tips. And to make a point on the nutrition, there are so many easily transportable foods that you can bring with you. And it really is so difficult to rely on what you can find outside of your home, especially when you're in a pinch. So to the extent that you can meal prep, and we actually did a whole talk as well on this at Albert Einstein with their culinary medicine group, how to meal prep, like how to, get yourself to the grocery store or, order online to have it delivered because you're not going to be there for it. There's a way to plan and make some of this happen and build it into your life as much as you possibly can. So Yoav, do you have anything else to add?
Yeah, I think it was a little touched on a little bit at the end of what Dr. Comander was saying, that really focus. I mean, there are 6 pillars. You have a 15-minute clinic visit. You're not going to hit all 6 pillars. Like, that's okay. Really honing in on one thing and really focusing on the shared decision making. So the patient mentioned, oh, my diet's not great. Oh, I don't sleep well. I'm smoking a pack a day. You say, okay, we've mentioned these things. Is there any one you think, bothers you the most? Or is there something in particular you would, you're most focused on? Like, okay, well, I think I want to cut down on my smoking. And you ask them, okay, so tell me more about why you chose this one over the other two, or whatever it is. I'm really focusing on motivating the patient or the provider or whatever it is, even if it's yourself who you're thinking about what are the things I want to change, focusing on one start. Because once you start one, doing the second one's not as hard. And the third one's not as hard. And you shouldn't expect patients or yourself to change your lifestyle immediately, because it doesn't work like that. And that's kind of the tidbit that I often try to give my peers when I'm trying to motivate someone. And it's how I like speak to patients who are admitted, and they're being discharged today. So I talk to them about a gout healthy diet because that's what they wanted to learn about. But they have other problems going on. But these problems aren't in a vacuum. So you start with one and you can move on to the others later on.
Thank you, guys. Okay, so then the final question we'll take is, so there's an entire industry of supplements to improve health. Is there any value in this?
Happy to start with this one because, oh boy, great question. And yes, if you go on whatever social media platform you want, go on the internet, whatever, you're going to find some, I guess I'm a middle-aged woman. So I'm getting all kinds of things thrown at me for like menopause and blah, blah, blah. I mean, I will just say, as an oncologist, the data does not support the role of supplements for individuals with a history of cancer to help prevent recurrence. There's really minimal recommendations for supplements. So I'm very, very cautious about supplements, certainly with my patients and with myself and with my friends if they ask me about it. So there are certain instances where, of course, supplements may be beneficial. Let's talk about vitamin D. I'm here in New England. It's like dark most of the year, and I'm not going to get enough vitamin D because I'm just like not getting any sun exposure. So that's one example. We know vitamin D is important for so many things. Similarly, maybe someone is iron deficient. Yes, they would need iron. Okay. And that type of situation. Or there may be a rule for a calcium supplement if they're not getting enough in their diet, although diet is the best way to get the calcium. So, but a lot of the other things that are out there that my patients ask me about every single day, we look it up together, we look up the research together. And honestly, the majority of the time, these supplements are not well studied, except maybe by the company promoting it. They're not regulated by the FDA, so you actually have no idea what's actually in there. And so you have to be really cautious. And I always say caveat emptor, let the buyer beware. Okay, you just have to be very cautious about anything you put in your body. And I'm curious what Yoav thinks too, because I'm sure you have some education about how to approach this in medical school as well.
Yeah, I mean, people come in with all the herbal supplements and vitamins and other things they can find. And there's kind of 2 points to this. Is one, sometimes these supplements and things are part of someone's culture. And so immediately saying, no, don't do that, can kind of turn them off to all healthcare. So figuring out what their motivation for taking these different medications might be is part of starting the conversation here. Also reminding them, you're taking a vitamin C supplement, but they're not getting the fiber that might be in the apple that they could be eating, in the avocado or the orange or whatever it is. They're not getting a lot of the other nutrients. Reminding them and kind of telling them a little bit more about, it's not just the vitamin C that's in this orange. That's that fiber you need. That's the, other nutrients. There's some, some sugar and some carbs that are actually good for your body. And, talking them through, like, it's not just this one piece here. Your body actually needs all the things at once to be able to absorb things better. So sometimes there's a little bit of like miseducation about I just take an extra 10,000 milligrams of whatever, I'll be set. But your body might not actually be absorbing whatever it might be. They might be taking extra of. So there's a couple elements to peeling back, the reason why, and then re-educating them with the information you have. And that's been pretty effective, at least in some of my patient interactions. But you're not going to always change everyone's minds, and that's okay. But you can only do the best you can do.
Oh, you're new. Yeah.
Thank you. Thank you guys so much. We're just about at 9 o'clock. So I know everybody's eager to get on with their evening, although this was a fascinating talk. And if anybody has any further questions, feel free to email admin@joma.org. We always love to hear from you. If there are any topics that you would like us to cover in the future, we always love to address your specific interests, whether it's for the wellness component or for the health and medicine component. So I hope you all have a wonderful evening. Thank you all for taking the time out of your very busy schedules for being here. I really appreciate it. And I hope everybody learned at least one thing that they can take away from this and have one small goal that they can go chase. Thank you all so much.